Welcome back to another episode of the Active Health Podcast, where we talk all things health, fitness, and performance, and where we believe in taking an active role in your health. Today, once again, we're joined by Kim Mason, functional medicine coach. We're going to begin a series on know your numbers, meaning know the numbers in your blood work. One thing I found interesting watching Kim go through her training for functional medicine, and we dive into the research and know more and more about evaluating our health and looking into our blood work, is it's really important to know the numbers so that we have a benchmark and know where we're working towards and a picture of health. Where have you noticed some surprises when we started to dive into blood work?
I think the biggest thing for me is that there's a range of numbers. And so, you're always within this normal range. Whether there's a range of normal and then there's a range of optimal. And so when you look at those ranges, as soon as you fall out of that range, suddenly there's disease. And so if you can see a number trending in a direction or leaving optimal values, then you can start asking those questions of, what am I doing to cause that? Is there something I could do to bring that number back into optimal, as opposed to just wait for that number to fall out of range and then try to fix it?
Right. And I think I have an idea, but where do when you get your blood work back from your typical medical visit or doctor, they have these normal ranges. And where do those normal ranges come from?
Where they've set them.
Well, and I think the answer that I know is yes, there is there is some loose research on where it is, but it's kind of an average.
Sure. Yeah.
It's an average of the blood work they're taking on a regular basis. And so sometimes those normal ranges are the average of the people getting their blood tests done over and over again. And it's the average of potentially sick people. And I would argue that the majority of our population is kind of sick.
Yes.
Yeah. So I think, their benchmark of health, when they're looking at blood work, potentially isn't as good as it could be. And that's kind of what was interesting. And what I love about what you said is that there's these normal ranges on blood work, but then we could even actually have an optimal range that might be even better for our health than what these normal ranges are on our blood work.
Right.
And I think that's the point we want to drive home through this series. Because sometimes the ranges are so big, and there's one area that we're going to dive into today. But today, there's lots of different things you can look at your blood work. You can look at, things with your cells. You can look at hormones. You can look at blood sugars, cholesterol, and lots more. But today, I think we're going to focus purely on blood sugars.
Yep.
I don't know where this started with me. I think it was back in college, and I used to, probably one of the first health publications put out was Dr. Mercola, and he was a DO out of the Chicago area, and he pumped out tons of free information. I would just read his almost daily emails, but he vilified sugar, which, as research shows, he was correct. But so I have this fear of too much sugar. I think that could be a good place for us to start is maybe, why is sugar so bad for us?
Lots of reasons. So, there's beginning to come out with more and more information as to sugar's actually probably the bigger evil than even over salt. Increase or fat, correct. But the increase of sugar, your body can't handle high levels of sugar in your body. It wasn't meant to have that. And so it has these mechanisms in place to get that sugar out of your bloodstream to keep you in a safe zone. And so what your body does is it packs it into cells and into fat tissue and it stores it away until it needs it to use it as a fuel.
Right.
Sugar can be and is used as fuel for energy, but too much of it has to store it away because it becomes dangerous. So then it starts to cause our blood vessels to vasoconstrict, which changes blood flow. So a lot of times when you think about diabetics and they have poor vision, they have no feeling in their hands and their feet. Well, blood vessels are damaged. There's those tiny little vessels that get out to those extremities, and they now have damage because of all these high levels of sugar. It can affect your brain and in brain tissues. And so it doesn't just cause energy increases and crashes. It also causes health issues that oftentimes we point to other things for as being the problem with those.
Yeah, potentially we'll get into maybe the mechanism of consuming sugar and what the body, how it responds to it. But when we know we have too high of sugar, that's the problem. When we have too much blood sugar is the issue, and it's causing damage because of it actually creates an inflammatory process.
Correct.
So it creates some chronic systemic inflammation.
Yep.
And this is different than an inflammatory cycle that I fell and got a bruise, or I sprained my ankle, or whatever. An acute injury has an inflammatory cycle, which is good because we want tissues
Causes
to heal.
healing. Yeah.
But when we have something like a systemic inflammation caused by, in this case, high blood sugars, this is bad because the body is trying to fight an inflammatory process that doesn't really actually need anything to heal.
Right.
And so when we have these systemic inflammatory processes, specifically in the blood vessels, and we talk about, maybe sugar is more of a the culprit when it comes to chronic disease than potentially even fat, because of this inflammatory process, because it's actually the inflammatory process, the systemic inflammatory process that is causing irritation to the lining of the vessels, which then if we have the presence of cholesterol and too high cholesterol, then that will pack on to these injured sites on the blood vessels and get stuck, causing plaquing and blockages, et cetera. But I believe that this high blood sugar is the root cause of, I'm sure someone's done an estimate, but I'd say 90% of chronic disease.
It definitely has an effect on it. Yeah.
It's definitely a huge component. It's
something that you have so much power over if you choose to take that power.
Yeah. And I think this is a really good place to just mention, when we say taking the power over and have control over, we will 100% give grace to those type 1 diabetics.
Absolutely.
They have a completely different situation going on than the rest of us. So this is related to lifestyle affected blood sugars, and leading to what we would consider type 2 diabetes potentially. Maybe this would be a good place to just kind of outline the process of, when we can consume sugar. So that can include carbohydrates.
Yep.
And even technically your body is smart enough that if you don't have enough carbohydrates, it could take some proteins and convert it into sugars in the form, I'm going to be smart here, gluconeogenesis. It's a process where it turns it into glucose from protein. But anyway, so your body perceives this intake of sugar and then responds with, insulin. And insulin is going to be released hopefully in the appropriate amount to process the sugars.
Yep.
And our body is going to store sugars.
Either burn them or store them.
Burn them. So if they're in the bloodstream and we need energy, it's gonna burn them up through the processes. It goes through a process in the mitochondria to create ATP, et cetera. If it doesn't need them, it's gonna store them. We're gonna store first in the liver, if I'm remembering correctly, and then into muscle tissue. Typically, especially if we're not active, those areas become very full.
Yes.
Very quickly.
Yep.
And then
we store it in fat.
Yeah.
We create fat.
That's kind of I don't know if a lot of people know that is I think through, things, I don't know how we've been taught or through our society, I feel like so many people think that the fat on our bodies comes from the fat we eat.
Yeah.
And it's maybe partly true, but this is
a lot of it is excess sugar.
Excess sugar in our body. And so again, the enemy here is when we overeat, and so that could be an overconsumption of calories.
Yep.
But most of us, the standard American diet is very high in carbohydrates because they taste good.
Yeah.
And a lot of us drink a lot of calories and drink a lot of sugars without even knowing it. There's sugar hidden in foods that we're not even aware of.
Yeah.
But when we overconsume then of carbohydrates and sugars, we have an insulin response. And the insulin is trying to tell the tissues what to do. The insulin is if we need to give it to a muscle, and there's receptors on those tissues that are going to respond to the insulin. Yep. And when we do this too high for too long,
those cells become very resistant.
Right. So
then it takes more insulin to get the cell to respond to allow the sugars in.
Right. And so let's talk about that. So I think insulin resistance is a big thing to discuss and to know about. And so what that means is there's receptors on the outside of these cells, and insulin is kind of like the key to tell the cell to let the sugar in. And in a normal situation, it works. It works perfectly. The cell has those receptors, insulin comes on and attaches onto it, and it tells, hey, I got some sugar for you. You want to come on in? And the cells can handle it. But over time, if we continually have really high levels of blood sugar, we continually have really high levels of insulin, then those receptor sites are overwhelmed and they kind of get burnt out. Yep. So then the cells become resistant to that key coming in to unlock it and to communicate about the blood sugars. And that's when we get insulin resistance. So it can't get into the cells and can't be utilized appropriately. And it stays in the blood sugar and causes this inflammatory process and oxidative stress and this whole cascade of other things that we've talked about.
Yep.
So this is the danger. Like if I want to take a second just to scare the shit out of you guys, to be honest with you. So when we don't handle blood sugars appropriately, it can cause blindness. It can cause heart disease. It can cause you to have plaquing in your arteries. It can cause you to lose numbness and tingling and feeling in your feet and hands. It can cause neurodegenerative diseases. This is the root cause of so many of our chronic diseases. Fertility. Let's be honest, guys. It can cause impotence because of blood vessel change. Like anything that you enjoy in life, high blood sugars chronically can ruin. Mm-hmm. And so this is a very serious topic for us to look at and be aware of. So let's arm them with some things. So when we're looking at our blood work, if we're trying to evaluate where we're at today as a baseline, what are the markers we're looking for in our blood work, and what are we looking for?
So the most common one that, your most basic blood work will typically measure is your fasting glucose. Mm-hmm. And so this is just a snapshot in time of, what is my glucose running when I'm fasted? So typically when you go have your basic metabolic panel, this is on it.
And this is just a shot in time.
Yeah,
right?
It's just that moment in time in your blood.
When they took your blood right then, that's
what your
blood sugar was.
Yep.
And like you said, just so you guys understand what she's saying, and hopefully when you get blood work, normally it is fasted, meaning that you typically go in the morning, or they tell you to not eat for at least 12 hours
Correct.
before.
Yep.
And so typically, because you haven't eaten for 12 hours, your blood sugar should be pretty low because you haven't consumed any food to get into the blood sugar.
Right. Correct. And so your normal ranges are 70 to 99. That's what is considered normal. Optimal would be more 70 to 85 or 90.
Okay, let's pause there. So normal on your thing is
70 to 99.
70 to 99. Okay, we'll come back to that. But optimal would be
like 70 to 85, maybe 90.
Got it. Okay. We have someone in our family that just got blood work not too long ago, and her blood sugars was 120.
Yeah, like 119. And like history was like she was never under 100.
And was never told this was an issue.
Correct.
Which is interesting because even the quote normal.
So pre-diabetic is 100 to 125.
Right.
So there are like norms for like pre-diabetic, but like she was never even told like, hey, your blood sugars are kind of running on the borderline, but they're waiting for it to be above 125 because that's when the typical medical has something to offer you.
Because before that, like leading up to it or trending high, they don't.
There's not. I mean, unless we want to talk about lifestyle and diet, nutrition, and all of those things, which most offices don't have the time and the ability to have those discussions. Mm-hmm. There's not a lot they can offer you until like you've now become full blown diabetic, and well, now we have a solution for you.
And I think this is where I'm seeing a lot of patients that are maybe subclinical, sub-threshold of these pre-diabetic stage or diabetic stage. And so they potentially are getting their blood work. If they're getting their blood work on a regular basis, that's the first thing, is most people aren't getting that done. But even if they are, they've been told your blood sugars are good.
Yeah.
But yet they're showing up in my office with, some tingling in their feet, numbness in their feet, and they're starting to feel like they're starting to have neuropathy.
Sure.
Well, it's because for the last 15 years,
their blood sugars have been running pre-diabetic for a long time.
High, and starting to see this damage taking place.
Right.
All right. So we got fasting blood sugar.
Yep. So the next most common one is an A1C. So a hemoglobin A1C. And this measures an average of what your blood sugars have been running over like a 3 to 4 month period. So it just gives you kind of a more average look, not just a snapshot in time. So again, there's ranges. So like below 5.6 is considered normal. 5.7 to 6.4 is pre-diabetic, and then above a 6.4, you're diabetic.
Yeah. So this is an important. So I do some DOT exams, and we all know those semi drivers have a harder time to live a healthy lifestyle because they're sitting all day, they're on the road, et cetera. And they'll always come in and we do a urine test, which actually tells us if they have sugar in their urine. We're in a bad spot because their kidneys aren't processing sugar, et cetera. But then and they'll always blame it on, I just drank a Monster, or I just drank a Mountain Dew, or it's whatever it was. I just ate a donut. Which, going back, just so we know the difference here, that would raise the fasting, potentially the fasting blood sugar in the moment.
Because you're not fasted.
Right. But I don't care what you ate for breakfast. It's not going to change your A1C.
No.
Your A1C is kind of giving us a picture of how well your body is processing sugars, like you said, over the last 3 to 4 months. So it's not that shot in time. It's the average over the 3-4 months. So it's giving us like, how are you doing over a period of time rather than we're not judging you on today.
Correct.
Right.
Yep.
Okay. And you saying optimal would be?
Optimal is 5.6 or under.
Correct. All right. And so what are maybe some things that in this area that people could start to experience or expect if their A1Cs are out of range for an extended period of time?
I mean, if you run a high A1C, so there's a statistic that was I came across it in a podcast, so I'm not sure where their stat came from, but if you run above a 7.5, you lose an average of 100 days off of your lifespan in a year. It's like when you start to put like lifespan in a year. So like if you run that level for 15 years,
right,
you're losing 4 years off of your life just because your blood sugars are not controlled.
Right. And so I'm gonna give the medical system a little credit here. If you're getting your blood tested and you have a 7.5. If you have a 7.5, if you're getting your blood tested and you show up with a 7.5, they're going to try to help manage it. Now, we could argue how they manage it, but they're going to tell you needed to do something. So this is happening when you're not getting your blood tested. If you're not doing your yearly test, if you're not
or if you're not choosing to take the advice of your medical professional.
That's true too.
Not applying what they're telling you to do.
That's true.
Because it's hard to do some of those things and overwhelming.
That is true. But so the first step is making sure we're getting our blood work done in the first place. So we have a baseline, know where we're going, what's going on, monitoring our health. And then if something is showing up, to do something about it. So is there anything else in the typical blood panel that they're testing for?
No, not really. But there is one that I've started adding to like a lot of the blood panels that I'm running, and it's a fasting insulin. Mm-hmm. And so we had talked about that insulin is what your body produces to bring that blood sugar down.
Right.
And so by drawing a fasting insulin along with your fasting glucose, it allows you to see how hard is my body working to get my blood sugar level to where it's at. Mm-hmm. And so, the more amount of insulin we're requiring, it can help us see if there's some insulin resistance going on. Correct. And so if my blood sugar is 93, so I'm kind of in that I could do better range, and my fasting insulin is also very, very, very high, then I'm probably heading to trouble if I don't make changes.
Right. And you're kind of saying your fasting blood sugar and your A1Cs could be kind of normal.
Yeah.
But then if your insulin's really high to do it,
it might be like that little first baby step that we can see, okay, we're starting to have some issues keeping up.
And so potentially that would be, hey, potentially you're not making the right lifestyle choices, but for now your body's compensated.
Correct.
And that's this was the one that when we came across this, that I was like vindicated by because I don't think I've actually ever tested my insulin levels yet. I'm going to do that soon. Because, it's, to me, you don't have the whole picture without having the insulin.
Correct.
Like you have a part of the picture that, hey, we're currently, potentially the blood test would show that you're handling your blood sugars pretty well.
Right.
But maybe your body is just overcoming it so much. And if you are, so let's paint the picture, your blood sugars and your A1C is in pretty good range, but then this insulin is really high. What I'm hearing is I'm just burning out my pancreas.
Yeah.
I'm burning out a tissue I'm forcing the tissue to work too hard because of my lifestyle choices.
You're definitely trending in a not ideal direction.
Right. So
So then the other shocking part of that is, so when we talk about normal and optimal. So a
Right.
normal fasting insulin is from 3 to 25.
Mm-hmm.
So that's a pretty big range.
That's a big range.
But optimal is 3 to 7. So single digits is where
Right.
you really want to see your fasting insulin.
But they would say you're normal at 20.
Within 25.
Or even let's say you're at 20. They'd say, yeah, you're sitting good, where optimal is 7.
Right. But again, it's just looking at it at a different angle. Like, so yes, you're still within normal, but what is the trend showing? Like, what is the projection? So if I keep doing exactly what I'm doing because you told me I'm good, what is that going to do in the future?
Right.
Where if I look at this number because it's trending, it's pushing in the direction outside of where I want to be, then that can throw the power back in your court on what can I do to change things? Because obviously if I keep doing the same thing, I'm going to continue to get the same result. And the results that I'm getting by looking at these numbers, it's not looking good for me,
Right.
And so like when we start to see some of these things trending on the higher end or kind of getting out with, outside of those optimal ranges, again, it's a prime time to decide, I don't want this to continue in that direction. So now what can I do to change that?
Yeah, that's perfect. That's the power in having the numbers. To know
it
your
is.
numbers is to be able to get these appropriate numbers, to look at them so we can start to see, maybe how are you trending right now? But the power is when you have regular blood tests to see how your body's trending in one direction.
So even when you're, feeling good, you're looking healthy,
that's a good time to have blood
That's
work.
a good time to have blood work to kind of see where your norms are. Because again, these are just ranges. Like, as you said, these are average numbers that you want to stay within, but like your number that feels good to you isn't going to be the same number that feels good to me. So again, lab work can come back and it can look normal,
You could feel
but you could feel awful. And so then that's when you start to dig to say like, okay, so yes, everything is kind of, it's within normal, but like what symptoms are we having? What issues are we having? Because something's not feeling right to you. So then again, that's when you start to like take those normals and then like, but where are we trending?
Right.
What's happening? Are things starting to decline that shouldn't be declining? Are things starting to elevate that shouldn't be elevating? Like, what signals is our body telling us with these symptoms that we can kind of get a trend within our blood work too?
Yeah, and this gives us so much power. And I think that's good. That'd be a good transition point for us to go from, okay, so we've done the blood work, we've identified maybe that we're trending in the wrong direction. What are some like easy things? And I know you work a ton with people on lots of different details, but what are some like just high level things that we can start to do if we start to see our blood sugars are trending in the wrong direction? What can we do in our lifestyle to take control of that?
There's tons of options. And I love to refer back to, it's the Glucose Goddess, and she wrote a book called Glucose Revolution. Her name is Jessie, and I can't even say her last name. But anyway, Glucose Revolution, Glucose Goddess, that's where you can follow her. But she has 10 hacks in her book that she suggests people do. So these are 10 things that you could implement, and you should not implement all 10. It's pick and choose what you can fit into your lifestyle. Some of my favorite ones is move after you eat. So super easy. It's accessible. That can be go for a walk. That could be get up and do the dishes in your kitchen and clean up your kitchen. That could be go outside and play with your kids. Just get up and move 10, 20 minutes after you eat. And so what that does is you've just put food in your mouth, so sugars in your mouth, things your body needs to burn. Well, now it's going to give your body a way to burn what you just put in your body. So super simple. Like it's accessible to anybody. Anybody has the ability to walk or to play with your kids or to clean up your kitchen.
Cost zero.
Yeah. So that's one of my favorite ones. Another one that I talk to a lot with my clients is the order in which you eat your food matters. And so again, you can take the plate of food you have in front of you. Start by eating your vegetables or your fibers.
First step is have vegetables on your plate.
That's true. Step one, have vegetables on your plate and eat those first and finish your vegetables. Then you eat your protein. And then last but not least, you can have your carbohydrates. So it's not that carbohydrates are bad. We need carbohydrates because it is an energy source for our body. We don't need a full plate of carbohydrates. And so by putting them in last, it makes it so it absorbs into our bloodstream slower. So it doesn't hit our bloodstream and cause a huge increase or spike in your blood sugar. It allows your body to absorb it at a slower pace and burn it more evenly.
And potentially we'd have a little bit of fiber already in there because of the vegetables.
Correct.
And the fiber combined with it allows it to kind of release a little slower as well.
And so again, you don't get that huge spike or that huge surge in your blood sugar. And ultimately, you're probably going to eat less of the carbohydrate because you've already started to fill your stomach with those fibers and the proteins that you really need. And then there's just a little room left for the carbohydrate. But so many people are like, don't take away my pasta. Don't take away my bread. I'm not.
Because they give you bread at the restaurant first.
Correct, first. So, I mean, little things like that. So, like, don't take the chips at the beginning of the meal, but allow yourself to enjoy the chips within your meal or towards the end of your meal. And it's not that you can't have them, because again, when you start to have that mentality of I can't have it, what is the one thing you crave or you want the most? That one thing. Well, you can still have pasta. Just have it in a portion that's a smaller amount, pair it with a salad, get a good meaty sauce with it, and eat your dang pasta.
Sure.
And it's okay. But the order in which you're eating it will change how it affects your blood sugar. Same thing with sweets. Everyone's like, oh, I have this huge sweet tooth. Don't take away my sweets. Well, then eat your sweet directly after your meal. Don't eat it on its own an hour or two later. Eat it right when you're done with your meal. So again, you've had your meal in the correct order. You've had your fiber. You've had your protein. You've had maybe a little bit of carbohydrate. So you have food in your stomach. So it's not going to, so now if you're going to have a little dessert, again, you're going to eat a little less because you're still kind of full from your meal. And you have this other food in your stomach to slow the absorption of that sugar. So you have less of that, again, that spike and that crash.
Cool. And what I love about these tips that you're giving right now is you're not asking them to change anything yet.
No, we're modifying some things.
We're just modifying. So we're not asking you to do anything different other than so far just move a little bit after you eat. Just change the order of your food and timing. A little bit with it. If you are going to have a dessert, clearly we want to control that, but have it just right now.
Yeah. And I mean, she's got 10 on here. Yeah.
Right.
And they all kind of intertwine a little bit. But again, there are super simple things that just being aware of, like even what's on your plate and why it's on your plate.
Yeah.
A carbohydrate, again, was not meant to be the entire portion of your plate. It was meant to be a quarter of your plate. And so it comes back to, I know I talked about the last time I was here, the plate method.
Right.
Half your plate is non-starchy carbs, so your vegetables. Quarter of your plate is your protein, and a quarter of a plate is a carbohydrate. And it fits right into the same thing that, like, it's portion size and portion control. And then again, when you take that plate and then you eat it in the correct order, we're no longer having these spikes and dips.
Right.
So now our body's at more like a homeostasis. So it's not going into reaction mode of, oh boy, here we go. Blood sugar's all over the place. We got to go take care of that. And now we got to pack it away as fat. It's now our blood sugar is at a nice even keel because we need blood sugar to survive. You got to have energy, but you need your blood sugar to do this throughout the day, not spike, crash. And now when we crash, what does our body do? It makes us hungry because we got to get.
So we're spiking it again.
So now we're going to spike it again.
Because we're going to eat.
And so it just puts us in a very like up and down dip all day long.
Yeah.
And so another one that's on her list is it's about breakfast and like how important breakfast is. So the majority of people, what's the first thing you get?
Coffee.
And what do most people put in their coffee?
Sugar.
So how do we start our day?
With a huge spike.
Correct. So if we just eat a protein breakfast first and then have our coffee after we've had some protein and some fiber in our stomachs, again, we're starting our day off at a nice even kill instead of this huge spike. And then what do we all do in the afternoon? Mid-morning, we all crash, right? And that's exactly why we've crashed, is because of that whole, now our body's like overcompensated for that blood sugar. So now we go eat food again, and then we just start the whole cycle over and over and over again.
Correct. And I think the big takeaway here is just an awareness.
Yeah.
Whether it's awareness in the blood work and awareness of what we're putting on our plate, awareness of how much sugar is in it. And all of this takes effort, and it takes, you got to do things a little on purpose.
Yeah, for sure.
I mean, I think that's the big takeaway is we are what we eat. We do have control of this one thing. And I think, I do really actually want to scare people a little bit that this is a super important thing for people to look at and be aware of. Again, it is my belief, even if it's arthritis of the joint, chronic pain and fatigue that I see on a daily basis in the office, a lot of these people, yes,
because of inflammation and stress we put on our body because of the choices we made in our foods.
Literally the physical pain that people are feeling, a majority of it could be related to just the systemic inflammation, like you just said. And so if we didn't have the systemic inflammation, yes, we're still going to have those traumas that can lead to arthritis. And yes, we can have those traumas that need musculoskeletal care. But our inflammatory cycle because of the trauma is not as high, so we won't have as severe pain. And so this is a really big deal. And so I don't think we can get to all of this in a single podcast. So again, this was intended to just be, hey, this is important. Let's look at this. Let's make you aware of of what parts of your blood work you should look at, make you aware of what normal values are and potentially what optimal levels are. And I hope that you've gotten some value from that. And if you need help dissecting your blood work that you already have, maybe you already have some blood work, or maybe you want some new blood work, you do this for people, right?
Yep.
Yeah. What's that? How's that work, or what's that called? Or
So they can visit my website, wellnesswarriorfm.com, and they can book a discovery call with me, which is just a really easy phone call that I just kind of get to know you a little bit. What is it that you're looking for? What is it that you're seeking? And we can do blood work for you. You come into the office and I'll draw your blood work myself, and we ship it off in a kit, and then the results get emailed back to me. And then from that blood work, we can make recommendations. And then I also do coaching. So like, some of these things sound easy, but like it's hard to change your lifestyle.
Right.
That's why we are where we are.
So that's super neat. So you'll actually you kind of, I've seen you do this with people where you just take their blood work and you kind of give them a playbook and say, here you go.
Yep.
And very comprehensive. I've watched you work on that.
It's extensively detailed.
Yes.
And there are some who can implement it on their own, and that's awesome.
Yep.
And then there are some who they need the extra accountability, the extra encouragement, the pat on the back when they're like, I think I've really messed up this week. And I can look at them and be like, no, you had 5 out of 7 great days.
Right.
And then like, sometimes that's what people need to hear. Like, oh, I actually did have 5 out of 7 great days. Okay. I'm not failing. Right. Or to realize that like, I don't have to do all 10 of these things at one time.
Right.
Try implementing one. Right. At one meal a day,
right?
And like get really good at that, and then attack the next meal of the day. Because the thing that makes us fail the fastest is when we take on too many things at one time.
Right.
Because we're human and we can't change our habits that way. It just doesn't work. It just creates more failure in our life, and the more we feel like we failed, the less we are to change our ways. And so that's where coaching is like the huge benefit is that you have that accountability, you have that encourager, and you have that person that's around to say like, whoa. Let's try one thing at a time instead of 70. Right. Because you will fail at 70.
Right. And it's cool that you're able to do that and work with people, and it's so personalized to them. And you mentioned that we would do the blood work here at the office, but if you're watching this and aren't local, I mean,
it can be mailed to your house, and you can find a place to draw your labs too.
And technology is amazing. Yeah. You
and it can be a Zoom phone call and an emailed recommendation. And
so you could do this virtually, but again, where you're at, you're wanting to meet people where they're at.
Absolutely.
We can do the blood work, even coach you how to get the blood work. Maybe you don't, yes, if you order the blood work through us, you do have to pay for it. We're not billing your insurance, but maybe at the discovery call, you could talk to them about requesting the blood work from their provider.
Correct. Or, you have an appointment coming up. I've done that with my parents that, they're on government Medicare. Insurance with, because of their age, and I knew they had blood work coming up. And so like, hey, will you ask your doctor just to see if they'll draw this with it? And they've had no issue with, annual blood work. Hey, would you mind drawing a fasting insulin with that? Oh, sure. Okay.
Yeah. No issue at all.
And then
that way it gets covered by your insurance, and you get the information that you need.
Yep.
That's the biggest thing is when you're working with someone, you just need the information.
Yeah. Yeah. Absolutely.
But I tell you, it is a great way to do it, especially if you're kind of new to this and not knowing. I've ultimately, over periods of time, when you work with a coach or a good health provider, you learn. You learn about your body, and you start to learn like what's normal, what's not normal, not only how you're feeling, but you can start to learn and look at the numbers. And so the more you use someone like a coach, quite frankly, over time, the less you need them.
Absolutely.
Is the idea.
Yeah.
Is hopefully you're teaching them something. So starting even with the kind of the know your numbers plan, and maybe it's just a plan recommendation, and see if you can implement it on your own. If you need assistance in that, then you have the coaching available. It's just kind of a neat situation that you've developed there. So wellnesswarrior.com.
Wellnesswarriorfm.com. Yeah.
Wellness Warrior.
FM for functional medicine.
Correct. Is where you can kind of get started there. And if you have questions at all, obviously, if you're seeing videos from this, you can make comments, and we'll touch base with you and reach out to you and make sure we get the information that you need. But I think in wrapping up is we just want to make sure that we understand knowing your numbers is important. We're going to do this in different areas of your blood work. We'll probably look at probably the next one might be on cholesterol. Mm-hmm. I think that's a big topic that is kind of confusing for people.
Absolutely.
Of course, it's confusing for everyone, but particularly as a consumer and a patient. And we may even get into hormones at some point on one of these, but knowing your numbers and having that baseline is super important. But this blood sugar one was a big one, and I think it was important for us to review it in a lot of aspects. So I hope you're enjoying seeing this information. Look for the future episodes on the other Know Your Numbers. But if you're ready to get started and want to start looking at it, obviously visit wellnesswarriorfm.com and get started, and she can help you get started looking at and knowing your numbers and taking control of your health because you know your numbers and know what's going on. Again, thank you for watching. Like, share, and comment, and share this with everyone. We'll see you at the next episode.